have there been any communication strategies or things that you found that have been able to kind of get patients to let their guard down a little bit or trust you a little bit more as a provider?
Yes, so I'm able to connect with them as it relates to the trust issue. Um, I explain to them that many times I put myself in this situation. So I say, if I were to be in your position, this is the option I think I would have chosen. And, just basically explain that we're here to help, not to harm, and explain the steps in a way that they can digest and understand and apply to making the decision for themselves.
Mhm. There's a lot of conversation around changing trends in age of cancer diagnosis, for example. I'm
Hmm.
wondering if you've seen any shifts in any of the characteristics of your patient population over time at all.
Yes, yes, oh, definitely. We have seen that, especially in breast cancer and colon cancer. So we're seeing a shift toward younger patients being diagnosed with those two cancers. Unfortunately, it tends to be more aggressive, especially in breast when it's diagnosed younger. So in patients who are younger than 40 years old, the cancer tends to be way more aggressive.
Mhm.
Yeah.
Do we know why or have any idea why the cancer is often more aggressive in younger populations? And does that also change or rely on other demographic factors of the patients? Like, do you have any insight on that?
So a lot of research is ongoing at the moment to try to explain why that's the case. That it has to do with the biology of the tumor. It just tends to be different than it is in older patients, which is responsible for the aggressiveness. Yes.
Interesting.
Hmm.
Um, so when it comes to younger patients, what are some of the
Hmm.
considerations that you have to take into account in treating younger patients versus patients that are more in the what used to be the expected age range of the
Yeah.
disease?
So for younger patients, many of them don't want to be bothered. They want to live their lives. They want to go out with their friends. And sometimes, for example, a young woman who's diagnosed with breast cancer and requires surgery, so the removal of the breast, that can affect the way they see themselves, body image, which can impact relationships. And we've seen that happen on more than one occasions. So that's a challenge in the younger population. More we see it more so than in older patients.
Mm,
Um,
interesting. And what have you seen as far as the risk of relapse among younger patients or even treatment resistance, for instance? Are they
mm.
faring kind of similarly to um, older populations, or do they completely look like completely different when it comes to those factors?
So one of the challenges, if they require maintenance therapy as a part of their care, they may not be as adherent because they see it as it's just interfering with their lives. So imagine taking a pill every day that is causing side effects, and you have to do it for years, for months or years. When we have issues with adherence in that regard, then the risk of recurrence is higher. But in general, so of course, this is way more nuanced because you have different types of cancers that would explain the risk of recurrence. But in general, when patients are part of their care and they understand that even though this is inconvenient right now, you need to, do this or do that, then we see a better outcome. Hmm.
Interesting.